Pap smears to test for cervical cancer for the last 50 years. Many patients and healthcare providers say that a Pap is a woman's annual exam, but women might need to find a different nickname for their annual now. Eric Edwards has more.
So my sister, she was an amazing sister, mother, friend. She was my best friend.
Maureen Russo was just 37 years old when she lost her battle with cervical cancer.
It was really hard to watch her slowly go downhill and leave her young kids behind.
Even though Maureen got annual Pap smears to check for cervical cancer, doctors say her case was aggressive and an exception to the rule.
It really does take years to see changes, and that it's highly unlikely to see changes from year to year when you've had a negative Pap smear already.
That's why the U.S. Preventive Services Task Force has issued new guidelines extending the time between Pap tests.
We're recommending that women ages 21 to 65 undergo screening every 3 years and not for shorter intervals.
We're going to go ahead and use this for the Pap test.
The guidelines also recommend women under age 21 and over 65 with a clean Pap smear history not be tested at all. And women in their 30s, 40s, and 50s have an option to wait every 5 years if they combine their Pap test with an HPV test and both come back negative. Dr. Wanda Nicholson helped create the new guidelines and says fewer screenings will lead to fewer false positives.
And the issue with false positive tests is that it exposes women to further testing, and also there is the potential of overtreatment. So in fact, women may undergo a procedure or treatment for a lesion that wouldn't otherwise progress to cancer.
Experts say women with concerns should talk to their doctor about their individual risks and whether they could benefit from more or less testing.